Hi, and welcome back to Outspoken, the podcast by Fem. I'm Sarah, one of the founders here at Fem, and I'm excited to be hosting today's episode. Since it's Endometriosis Awareness Month, there's no better time to shed light on the challenges faced by those living with this condition and the urgent need for better care. Today I'm absolutely thrilled to be joined by Nicole from Endo Excision for All, a passionate advocate who has been at the forefront of raising awareness about endometriosis, championing excision surgery and helping countless individuals navigate their journey towards better care. Hi Nicole, and welcome to the podcast. So I'm really excited to have you here today. I'd love to start off with just sort of covering why endometriosis has such an impact on the women that have this condition, and also a bit about your personal journey.
Yeah, so endometriosis, for listening and don't know, chronic disease when it's a full body anti-inflammatory disease where tissue that is similar, not the same, but similar to the tissue that grows inside the uterus goes outside,
Yeah.
and it can travel, it's been found on every organ in the body. So a lot of people think it's just bad periods or a period disease or reproductive disease. It's really not. It's full body, it can go up to your diaphragm, cause your lungs to collapse, it can go in your sciatic nerve and cause you issues walking. It can go in your utero, it cause issues with urinating, going to the bathroom. So it's a full body disease, and a lot of people don't know that. So I really want to start off with that point. But a little bit about me. My name's Nicole. I have endometriosis. I had surgery in May of 2023, but my symptoms, and I was 26 at the time, but my symptoms started now knowing that, and there was a full body disease around nine, because that's when I started having really bad gastro symptoms, but we didn't know the correlation. I always say I was lucky in a sense that I knew what endometriosis was, because my mom was diagnosed with it when I was born via C-section. So when I started having symptoms, the real like debilitating period symptoms and my stomach issues got like intolerable. I was about 16 years old. So I was a sophomore in high school. But I was lucky in the sense that when I went to a doctor and talked about these symptoms, my mom was able to say, I have endometriosis. I think she might have endometriosis. What can we do about it? So at least I was able to do my own research because all the doctors I went to, endocrinologists, gastroenterologists, urologists, holistic doctors, internists, all of them, they have gynecologists. They're like, there's nothing you can do if you have endos. Really, like, you can go on birth control, but that won't do anything. And I've always had in my head, I'm like, I don't want to go on birth control for no reason. If I'm going on and I want you to do blood work and see if my hormone levels are off, I want you to be able to like monitor me. And I always asked about surgery and they wouldn't do it, which in a sense, again, was lucky because as I did my own research, I was able to find an endometriosis specialist and then get surgery for endometriosis the proper way with excision when I was 26. So almost a decade later from when I started that research.
Yeah, I think that's it. And I think like covering the fact that it's whole body disease is something I only sort of discovered when I started exploring everything for my diagnosis of adenomyosis.
Yeah.
There's a lot of obviously there is crossover, they're two totally different conditions, but reading that about endo and it's a whole body condition and how
Yeah.
much of you it can actually affect was quite a surprise to me, to be honest. So yeah, I think it's really interesting, and I think the whole 7 to 10 years for diagnosis can be really challenging for people. I think again, I have a different condition, but I was sort of on the fertility track, and I'd had lots of different tests done for about a 6 year period. And it took me going through private healthcare earlier this year to get actually a really prompt diagnosis, have some surgery to support my symptoms that I required as well. But I think even after that, it's still such a journey because I'm still experiencing symptoms. Obviously, I've had a treatment plan put in place and it helps. But like I said to you before we started this podcast, I'm having a tough day today with symptoms. So it's such an ever evolving journey. And I think the mental stability for me behind that can be really challenging because I just kind of wish some days I woke up and I didn't feel so rubbish.
Yeah.
I don't know if that sort of resonates with you and how you sort of feel about the time it takes for that diagnosis and what we could maybe do better. I mean, obviously, there's different healthcare systems and they run things in very different ways, but I think across the board, it takes a long time for people to get that diagnosis that they really need to move forward with treatment plans.
Yeah, and I mean, different healthcare systems, but the same dilemma where your experience, you have to seek out private care to get your diagnosis and get proper care. And similar here in the States where if you're just going to your in-network doctors, you're not getting proper. I mean, there's no insurance code
Yeah.
for or real insurance code. There's some codes that you can kind of manipulate sometimes, but that you have to, like, essentially get lucky. There's no true excision code, so you have to go similar to your private healthcare out of network,
Yeah.
that can cost thousands of dollars. So it's unrealistic to find proper care here as well.
Yeah.
But in terms of managing symptoms, I mean, that's another thing too, even, post-surgery, it's you're not guaranteed, and I went into surgery thinking, like, "This is gonna be amazing. I'm gonna feel
Yeah.
great. I'm gonna spend thousands of dollars and do it the right way. And that's it. I'm never gonna have pain again. Like that's it." And it wasn't until after surgery that I realized, like, and don't get me wrong, I was very lucky. It was life changing. They removed 73 lesions from my uterus. It was bilateral, so fallopian tubes, ovaries, bladder. They just took out my appendix because I was covered and it was on my rectum. I said bladder, artery, rectum, and colon.
Wow.
So with that, getting all that out of there, it helped a lot. But it's not, it grows back or it can grow back, especially when it's like stage 4. So now I'm at that 2-year mark where symptoms are starting to develop again. And it's like, come on, I just did this. And,
Yeah.
the 2 years flies. And especially with adeno, I mean, it really, it's a hysterectomy because since it's inside, I mean, they're not excising it from the outside, so it's like, that that's something you're gonna have to deal with one day, so that
Mhm.
takes a mental toll, I'm sure,
Yeah,
and
for sure.
when symptoms act up again, it's like, "Come on, man," and
You
I'm
just
like, "You still gotta go to
say,
work."
just give me a day, please, a day.
Yeah,
I can just feel like I did before I knew I had it. And I think a lot of women are living with these symptoms for such a long time before their diagnosis. And I was sort of contemplating with myself, and I'm interested to get your perspective. Like, what difference does a diagnosis actually make? Because I sort of thought to myself, like you said, in a sense, you go and you think you have the surgery. Yes, I'm gonna, be it back to normal, I'm gonna get in the gym, I'm gonna
yeah,
do everything I've been longing to do. And that's not the reality of it. And I think you learn that as you move through the journey. But I think the diagnosis for me, I was sort of like, oh, it doesn't really matter because I've been living with it. Nothing's really changing. Okay, the treatment's helped slightly, but I'm still very uncomfortable a lot of the time. And then I thought to myself, actually, no, I think I make more allowances for myself now. I'm actually thinking to myself, okay, like my body does need a break. I do need to
yeah,
relax a bit. This isn't normal to just tolerate these levels of pain and just try and live life a- as though somebody that doesn't have a condition like that. So, did the diagnosis make a difference for you, aside from obviously the
absolutely.
treatment?
Absolutely, to your point right there, that the pain or the symptoms are not normal, and especially because it takes so long to diagnose. Once you finally get that diagnosis, if it's 10 years from your first symptom, half of those symptoms or majority of them have become so normal to you. So, like, in my experience, it was the bad periods that I was like, "I can't do this anymore." Even, like, the stomach issues were so bad, I every time I ate, I'm, like, running to the bathroom, but it just became normal. I'm like, "Okay, so I have to get on a plane or get on a train or have a long car ride. I just can't eat before." And
Yeah,
that just became my, "It's no problem, I just can't eat unless I have access to a bathroom," and take medication and do all those things just to manage it, not get rid of it, but manage it and make it a little bit tolerable. But it was the painful periods, I'm like, "I can't do this anymore." And then once I finally got the surgery, And I mean, all that symptom relief of for the chronic fatigue. I mean, I just thought I was lazy, to be honest with you. And I'm like, I'm not a morning person. I just can't handle these things. I'm just lazy that I don't want to get up and do things. And then after surgery, getting all that inflammation removed from my body, I'm like suddenly getting up at 7 a.m. and it's no problem. I'm energized. I'm sleeping better. I didn't need the medication that I needed for my stomach. And I didn't even realize, like I said before, I didn't realize it was a full body disease. I thought that was a separate issue. So having the diagnosis, especially now as symptoms start up again,
Yeah.
it's I mean, to nowhere near what they were before surgery. So, but it's still chronic and not going anywhere. So as symptoms start to trickle in again, now because I have that diagnosis, I can say, okay, this is endo. If I'm getting pain with ovulation, I know, okay, this could be endo. Let's monitor. Let's see if there's an endometrioma and get more regular ultrasounds to watch and see if that can correlate with endo growing back. If getting that chronic fatigue again, like I'm not lazy. There's it's inflammatory disease. Like that's what's going on. And to what you said before too, like giving yourself time to rest and saying, okay, my body is telling me that it needs a break and I need to listen to it because I have this disease. It's not in my head, it's not anxiety. And I think that for me was the biggest part was saying, okay, I had this disease and this is why. Because I was even in high school, I was in and out of school because of my symptoms, primarily the gastro ones, but endometriosis. And because it doesn't show up on any scans or even having like the endometriomas, like the blood fill cysts, my gynecologist didn't know what that was. So they're just like, oh no, it has to be anxiety. That's why you're getting sick all the time. Like that's why you can't eat without running to the bathroom because if you have anxiety over going to school or going to anywhere. I'm like, I'm telling you, it's not the issue. And because every scan came up negative, they're like, it's all anxiety, it's all in your head. So then was put into outpatient psychiatric program where at 16 with other kids who had bipolar disorder, minor schizophrenic, manic depressive episodes, and I'm sitting there like, my stomach hurts or like I'm PMSing really bad. Like, why am I here? Like, there's something else going on. And even knowing what endometriosis was because of my mom's diagnosis, they
Yeah.
still were like, no, it's all in your head. This isn't endometriosis. That's just your bad period. So, like, that was the most validating thing of having surgery is getting that diagnosis and going back to my all the 20 gynecologists that told me that either I was too young to have endo or the only way to help my symptoms was to the craziest thing was that one doctor told me to be a surrogate because they said if you get pregnant and I know, yeah, I was with anybody there. I was 18. I'm like, I'm not having a kid. But they're like, just look into surrogacy, which that's not even legal in the States to do at 18. But they're like, just look towards that. Or, women with endo, if you have it, usually go into early menopause. So at least you're not going to be dealing with this as long as other women, all these crazy things. So that validation of, I got proper care and just knowing for sure, like, I'm not an endo fraud, like, I have it. It's just that validation, and then going to my old high school and going to the nurse and the guidance counselor and being like, "Hey, remember me? You told me I was crazy? Here's my pathology report. This is what they found inside my body. It wasn't anxiety, was it?"
This
But
is it. And I think, like, going through that journey could have also had such an adverse effect, actually, almost convincing you that you did have anxiety
yeah,
and other contributing things towards that. And I think listening to everything you've said there, the word relentless just comes to mind so much because it's either relentless in its symptoms, like you said, you've had, a period of time now of relief from the symptoms after having the surgery. You're beginning to feel the start of that coming back before any of us have treatment. It's that relentless month to month. We absolutely dread our period coming because we know, and you just kind of kid yourself, I think, and think, this one won't be as bad. Like this, I'll have a better one this time.
yeah,
And then, you're sitting in the shower at 3 a.m. because the heat of the water is the only thing that can just alleviate some of the pain, and you've taken as much medication as you can, and you just think, wow, how has it come to this? But the cycle does tend to repeat itself even after you've had treatment. And I think like that, I'm finding that particularly difficult at the moment because I think I kind of got into a cycle of the pain. Like I would have bits in between, like you said, like the ovulation pain and some niggles here and there. But, the predominant cause of my pain was my period occurring every month. At the moment, after the surgery, and I had the Mirena coil fitted during my surgery to help alleviate the symptoms of my adeno. But my body's really adjusting to that and causing me a lot of symptoms since the surgery every day. So again, like it's just this relentless goal to be sort of have a day where you just normal. I mean, I'm not even trying to achieve pain free at this point. I'm just trying to achieve, a normal tolerance of dealing with pain. So I think
Yeah.
over the years, how what advice could you give to people in terms of that relentlessness? Are there any like things you've turned to, or people that have really helped, or just anything really that, those days where we really are struggling to get through it?
Community support. So that is, even if you don't have it diagnosed, like even if you're not, surgically diagnosed, or I don't know, that they can see sometimes on MRIs and things like that. Seek it out. Like seek out, go online and do your own research and seek out other patients. And social media is a giant component to that. And I wish that pre-surgery, because I never did it, because I always felt like an endo fraud. Because I'm like, I don't really know if I have it. So I don't want to claim that I do, because there's women that are really struggling. Even though I was struggling. So I don't know why in my head I'm like, but
I think we
anyway,
all do it. We definitely all do that.
yeah, you like gaslight yourself because these doctors gaslight you for so long. But that would be my number one advice, is to seek out other patients on social media, because that's where we learn the most. That's where we get the tips for pain management. Doctors are like, here's birth control, let me know how you feel, or here's this pill, let me know how you feel. Here's another painkiller. It's other patients that you're like finding pain creams or different pelvic floor therapists, especially if you're, talking to people in your area, whether acupuncture has helped or other like holistic methods, different like a TENS machine unit. Why did no doctor tell me about a TENS machine unit? I was like taking way too much ibuprofen and acetaminophen, and it wasn't helping. And then getting prescribed these addictive painkillers at 18 just to deal with my period. Why did they not say, hey, there's also this thing called like a TENS unit that can help with not that it fully takes it away, but it definitely helps. Why did no doctor tell me about that? Like,
Yeah,
found that out from the community.
yeah, and the medication, like, we will all take the ibuprofen and things like that. But there's complicated factors to that. Consistently taking pain medication over long periods of time is also not good for you. So like you say, you kind of in this status, and I think lots more is being found out now about endometriosis and hopefully adeno. I think
Yeah.
less is known about that at this point in time because, like you said, I think I'd always felt like a bit of a fraud. I was like, oh, it's just a painful period. To be honest, maybe I just can't. I don't have a very high pain threshold. And then, I was thinking, I was expecting my diagnosis was going to be endometriosis, and it wasn't. It was adeno. So I think it's such a complicated process, and the symptoms present in such different ways with people as well. But one of my close friends has endometriosis, and as soon as I got my diagnosis, I instantly messaged her and was like, can I ask you a couple of questions? Do you
Yeah.
experience this pain? And does it feel like this for you? And I think that was so helpful. So I think the community side of things so important, like you said. And for me, like I've created a separate space for myself on Instagram because I think I'm the kind of person I have to interact with it when I'm ready to do so. Because I think if I followed it on my normal page, I can sometimes feel a bit overwhelmed as well
Yeah.
because it's fantastic. There's so much conversation. But I think when you're just going through those early stages of diagnosis and coming to terms with the fact it is a chronic condition that you're going to be dealing with, sometimes it's almost information overload and you're like, how am I going to cope with this? There's so much to consider and think about. So I think the spaces are really useful, and I think having that separate space so you can control how you interact with that is fantastic because I think you're really ready and invested to look at all that information and engage with it. And obviously your account, your Instagram account had some great information on there. And I think, like you
Thank
said, there's
you.
lots of really supportive accounts out there. So that's really a good advice, I think. And I mean, what are you sort of hoping for from the future in sort of the healthcare systems, and what would you love to see over the next sort of 5 to 10 years?
From the healthcare systems and even like the policy side all over the world. So
Yeah.
UK, United States, I mean, this applies everywhere. And that's why I started Endo Excision for All. My foundation is there's so many foundations that are fantastic for medical research and for advocacy and getting the name out there and symptom management, things like that. But for that you had to find private care to get proper care, and it's very similar concept here in the States. That's the main message that I love or want to get across is the difference between the outdated method of ablation, which here in the States is covered by insurance, and every gynecologist says is fine, and most gynecologists can do. And then the difference between that and excision, which is the proper way, which is where it can be thousands and thousands of dollars, and just the difference with that, because even when you're explaining it as a patient to another patient who is going through the process and trying to navigate their next steps, and their gynecologist, who they've been trusting for their whole life, is telling them, no, this ablation, this is safe, this is fine, like I could do this, I do it all the time. And then you go that way because it's covered by insurance. And then you start having pain a month later because it grows right back because they're just lasering it or burning it. You can get thermal damage from that process on other organs, and most often to the fact that it's a full body disease like we were talking about before, they're just going like around the uterus or the ovaries, and then they see it on the bowel or rectum, if they even see it, and they just leave it there like, oh, we're not going to touch that, that's too dangerous. It is dangerous, but it's because you don't know what you're doing, or the doctors that try to do it and end up hurting patients. But that's the main message to get across, and that's what women who reach out most often ask about is, why is this doctor telling me this way? But now I'm seeing online from all these other endometriosis and adenomyosis patients that that's a complete outdated method in the wrong way. And then my insurance, when I go to the specialist, insurance isn't covering it. And I don't have thousands and thousands of dollars. So what do I do now? So that's what Endo Excision for All is created for, is to help women pay for the proper way of getting care, but also working on the policy side of trying to make sure that a full code is created that no woman is unable to access that care because they can't afford it, or because their insurance company doesn't offer gap insurance, or they don't have it on a network deductible, and all the other crazy things that go with the insurance over here.
Yeah, I think obviously the two healthcare systems are totally different, but there are similarities in the sense of, like you say, it's about educating yourself. Once you've got that diagnosis and being able to advocate in that healthcare setting that this is the correct treatment for you, and you believe this will make a difference compared to something else. And that can be such a task to do when you're not feeling great and you come into terms with it. You're then having to kind of figure all this out for yourself. I'm definitely not medically trained or clinically trained. So you're looking through all this different terminology and trying to decipher exactly what that means for you and your body, your symptoms, and the condition in the long term. So I think those communities have a massive part to play in that, because it just really shares that impact and understanding what it's going to be like post surgery. And like you said, how long have you been symptom sort of free, or at a reduced rate of symptoms, so people understand what the expectations are after the treatment. Because obviously I went private, and I'm very fortunate that I was in the position to do that. But I've been diagnosed with a long-term condition. So I'm sort of thinking to myself, I know my treatment's probably not over. It is in the short term, but how would I fund that moving forward? Because if I tried to do private health insurance here in the UK, they
Yeah.
won't cover anything to do with a pre-existing condition. So any further costs that I would incur would have to remain to be self-funded, or will have to try and go through the NHS routes, which for me, it's probably a bit of a challenge in a sense. I do feel a bit, I was let down. I had 6 years of a fertility journey and lots of tests, and nothing came up. My fertility issues were unexplained. And actually, I've now discovered it's obvious why I was not conceiving a child, and I've had to now make that decision to kind of close that journey off and look after myself and my symptoms and have the coil inserted to try and reduce that impact to my body and my life. And that's something me and my husband have had to discuss and come to terms with. So there are so many moving parts, I think, to a condition like this. And I think communities can play a part in that sort of mental health support as well. But I think, there probably needs to be that therapeutic side along with the treatments and the conditions. How is that paired together? That those mental health aspects and the decisions some women are having to make and compromise, maybe that lifelong dream of having children or a family or, a second child or third child in some circumstances to make their own life a bit better and alleviate the symptoms. I think, that's not really spoke about that much, I think, in any of the sort of consultations or any of the journey. And I think that should be a topic of conversation because fundamentally it's something that most women look towards at some point in their life.
Yeah, and that's where, I mean, the community just comes back in is so important because, I mean, you could talk to any, if you have a good friend or family member or a partner, but if you don't get it, you don't get it.
Yeah.
And that's where the community is just so important because then you're talking to other people who are actually going through the same thing and can give you advice, not just on the actual like the medical side of things or the symptom management side of things, but on the mental aspect of when you're having a really down day and everything is so overwhelming, what do you tell yourself? Or even just simply feeling that support and being able to vent to somebody who's going through the same thing or a similar a similar issue, especially with the infertility stuff. It's just so I don't know how to explain it, but just talking to somebody who understands it, like if you know, you know. And that's the community. It's just so important. So it's definitely like there's so many women that share their stories. I understand that it's vulnerable and not everybody wants to talk about it, especially publicly. But if you reach out to the people that are talking about it publicly, 100% they're gonna be there and be able to put you in even if one woman reached out to me, I have not gone through the fertility road yet. So if a woman reaches out to me and says, "I'm struggling with this, like, what can I do?" I'm like, "Here," and redirect them to patients who are going through that, who can be a better resource. So it's really just to be able to reach out to other patients is, I feel like, the biggest method of finding proper advice.
Yeah. And I think it's celebrating the successes, even when they're small successes.
Yeah.
You've had that symptomatic day, but you've still achieved something you really wanted to achieve out of your day. And I think you do need to stop and take credit for those moments
Yeah.
because you may not have normally done so if you weren't feeling that way that day and you didn't know you had this condition. But I think it's so important to try and do that. And that will pick yourself up, even in those moments where you haven't got that community behind you. And I think sharing that information in those community settings will be that little twig that day to think, yes, okay, I've got this. I can actually get through today and still make it a good day. And I think anybody with any kind of chronic condition will probably relate to that because it just kind of never ends. So you have to find a way to live with it, I guess.
And that's
Um,
what the validation component of a diagnosis is, when you're having a bad day, when you're having a flare up, to be able to look at what you have accomplished. And even if what you have accomplished that day is letting your body rest, that is still productive. Then being able to, instead of looking at what you weren't able to do that day and focusing on that and then getting upset over what you can't do, so change that perspective and go, okay, even with how I was feeling, what did I still accomplish today? And like I said, even if that is just laying in bed and letting your body rest, that's productive because a lot of people don't have the self capacity to even do that and recognize that their body needs to rest. So that's still a productive day.
100%. I am definitely battling with that because I'm just not good at relaxing. I think I drive my husband bonkers sometimes. So I'm just chill, but I'm just not wired that way naturally.
Yeah.
So, like, I feel like I have to be doing something to be productive. So, I think that's kind of something I'm navigating at the minute. But what you said there literally just gave me a thought. I was like, God, when I need to rest, why don't I just think to myself, okay, well, I'm going to rest on my sofa. I'm going to read that book I've been dying to read for ages because
Yeah,
actually that's productive and enjoyable for me. So I think you'd sort of discover yourself along the way, and probably you could probably learn better ways to live because of the condition has prompted that, which, you may not have pushed yourself in that direction if you didn't have the condition because you just never would have had that thought process. So I think I always try and take the positive aspects, but that's not to say that, you can't accept your feelings on the day where it just does feel a bit rubbish and you kind of don't know what to do. Is there any sort of key advice you would give to anybody that's maybe thinking they've got endometriosis or a condition of that kind? Is there any sort of key points you would say to them, like just definitely do these things?
definitely seek out an endometriosis specialist,
Yeah.
not a gynecologist, an endometriosis specialist. There's so many gynecologists that have on their website that they treat endo, and it's like a now it's like a Google ad word for them, where they don't actually know how to handle it. They just so many women are getting diagnosed now, and they just want to have it on there. So to find an endometriosis specialist and then to have a full team. So the main doctor for you as a patient with endometriosis or adenomyosis or suspected endometriosis or adenomyosis to have that specialist and then have a team of doctors around you like a wherever your symptoms apply. So it's a gastroenterologist, endocrinologist, urologist, cardiothoracic, pulmonologist, wherever you're having your active symptoms that are outside the gynecological area, have that team and make sure that they're knowledgeable in endometriosis, truly knowledgeable, like test them. And there's a lot of endometriosis foundations on one of them, or just other patients who have resources online, whether it's on social media or a blog or a website, of questions to ask your doctor and red flags to look out for, whether they do know how to handle endometriosis or they don't, or if they are knowledgeable in it and they don't. But if they're not knowledgeable in endometriosis, I'm not knocking doctors. It's not their fault. They're not probably trained on it. The specialists are the ones that get that continued education. But that's number one. You have to be with the right doctor.
I think that's really good advice because obviously through my fertility journey, I dealt with a gynecologist, but I was never obviously diagnosed with anything. And then I went to see this gynecologist, and straight off the get go, he was pretty sure I had adenomyosis before even I had any examination or any form of procedure. He really knows what he's talking about, and I think that moment in itself was really gratifying. And although, I wasn't really sure where the journey was going to go at that point, I just thought, oh, okay, like he does know what he's talking about. I'm not going to be passed from pillar to post and go round in circles and not have an outcome to this. So that's really good advice, I think. And I think trying to find that, either in the US or the UK, it's probably just exploring online, doing some Googling, like you've said. And then when you get the opportunity to meet with that specialist, make sure they're the right specialist for you, probably. Do you go back and see the same specialist all the time now to help manage your condition? Yeah.
Yeah. So since he's a surgeon, or they're a team, but they do surgery. That's their main thing, right? They're not active. I mean, their start is in gynecology, but they're surgeons. So you go like once a year for a follow-up or if you're having symptoms. The key thing too that I didn't realize was to get an ultrasound. If a gynecologist or an ultrasound tech that you're going to, if they don't know if they're not familiar with endometriosis either or not fully knowledgeable on it, then they don't even know what to look for. So they just can go, oh yeah, you have a cyst, we'll monitor it, maybe go on birth controls, and we'll keep an eye on it. Instead of an endometriosis specialist who would ideally be your surgeon, they know what to look for. They know if there's if you have a cyst, how long has it been there maybe? Is it filled with blood? Is it endometrioma? What's the size? What other symptoms are you having when they do an internal exam? Are you feeling pain when they press on a certain area? That can mean peritoneal endometriosis, and whether it's growing back or you haven't had excised yet. So I mean, just having the right specialist, and they know what to look for. So even with follow-ups to ultrasounds, it matters who's doing it.
Yeah. Yeah, that's so true. That's exactly how I was diagnosed via ultrasound, which I didn't realize that was how it would be done. But like you said, during the procedure, he was asking me, "Is that more painful there? How does that feel?"
Yeah.
So, it was quite a lengthy process for an ultrasound, and that's how they understood that I actually didn't have endometriosis, that I had adenomyosis, and it was all in the lining of my uterus. So, and they discovered I also had uterine polyps at the same time during that scan. So again, different to fibroids or a cyst. There are so many things that are so similar but so different and do require different treatment. And I think that's where finding the right care makes a huge point of difference and can make that journey slightly easier because you're getting the right care from the get-go. And I think probably the last thing to touch on is probably the importance of earlier sort of diagnosis and discovery. I think specifically of endometriosis, I'm not sure how relatable that is to adeno because you can't really remove it. But for endo, I believe that's quite important, isn't it?
Yeah, that I mean, the earlier you can get diagnosed with endo, I mean, again, it's still you have to get surgery done, so to really remove it, but the younger you can get that, I mean, aside from the actual medical component of it not continuing to grow on and spread to other organs, and then have, like it can have irreversible damage where women have to get a bowel resection, or when it's on your uterus for too long, that impacts your ability to urinate. I mean, that's it's no joke. Growing on your diaphragm in women that have their lungs collapse, no joke. There's so many women that when it grows to her so long and it just kind of takes over your other organs and makes them stick together or turn around, and that's so many things can happen from that. Where when you're younger and you get it excised younger, then it sticks to the one area, and then you know how to manage it. And I mean, nobody knows the real so many theories about endometriosis and how it starts and how it grows, but the theory that it's estrogen dominant. So then you know to manage your estrogen and make sure you don't have high estrogen. I had high estrogen for 15 years. Like that fueled so much lesion growth that if I had surgery when I was 16 the proper way, maybe I wouldn't have 73 lesions by the time I had surgery. Then very lucky I didn't need a bowel resection. And then on top of it, the mental component where the things that I think about, if I had had surgery at 16 or 17, I would have been able to study abroad. I wouldn't have missed families' weddings and funerals and all those important things in life, work opportunities, things like that. And like there's so much resentment for all those things, even when you find proper care, so much resentment for all those things that you missed out on that you're like, if I had gotten diagnosed a decade or 15 years or 20 years sooner, not only would I not have this possible multi-organ irreversible damage, but I would have had such a higher quality of life.
I think it's also relevant, and we're discovering more and more, and we have to kind of be grateful for the progress that's being made. But I think there is still such a need for people to advocate for themselves and their symptoms and to seek that help and advice. And that isn't easy. So I think, the theme for me of our conversation has been lean on those communities because they really do understand how you're feeling
Yeah.
and they can probably pick you up and keep you going on those days where you're like, goodness, I don't feel well. And it's such a battle to get the care that I need to get better. So I think, for me, I found that such a helpful space. And I'm still really in the early stages of understanding what the condition's going to mean for me in the long term. So I will definitely be leaning on those communities and checking out your page a lot more. Even though I have a different condition, there's so many similarities and so much good advice on there that can just kind of make you think a bit differently and sort of pick you up on those days. Yeah, was there anything else you kind of wanted to talk about today beyond what we've gone through? Anything else you wanted to highlight to anybody with these sort of conditions?
Definitely seek out community and just also to talk about, and I have to do this too, to talk about adenomyosis more because obviously not the same thing, but so correlates. Even the symptoms, I mean, the pelvic pain, the
Yeah.
heavier painful periods, pain during intercourse. infertility, the chronic fatigue, the bloating and digestion issues. It's both sides of it.
Yeah.
So just to keep talking about it and for other communities out there, like I said, I have to do this too, but to talk more about adenomyosis and just provide more research for that.
Yeah, yeah, I think that would be fantastic, and to keep banging that same drum for endometriosis, there's so much more to discover, I think, about the two conditions, and, you know, I like to think in the next sort of 10 years, people wouldn't be having this level of conversation that we're having today, and symptoms could be managed better. Who knows? That might not be the case, but I think if we're not talking about it, we're not constantly putting it at the forefront of conversations, then nothing probably will develop or change. So, I think a collective voice in those areas can make such a difference. And like I keep saying, there's some absolutely fantastic pages out there and information online. So I'll try and make sure we include as much of that in the details linked to the podcast. But yeah, thank you so much for speaking with me today. To be honest, it's been really cathartic for me anyway. It's just always really nice to speak to somebody that can relate and understand. It's such a great space to be in. So
Yeah.
hopefully I can move forward in a positive way today now and get through it even though I'm feeling some of my symptoms. But thank you so much.
Thank you. Yeah, the more we talk about it, like we need to make endometriosis and adenomyosis a household name. Like
Yeah,
when you have a stomach ache and somebody's like, "Oh," or a stomach ache when you have like chronic stomach issues, and people are like, "Oh, do you have Crohn's? Like, do you have colitis? Do you have this?"
yeah,
When you have the symptoms that we deal with, we need people to be like, "Oh, do you have endometriosis? Do you have adenomyosis?
yeah.
Here's how you find that doctor," and just make it a household name, like people do with so many other issues.
For sure, for sure. Let's get on that campaign together and,
Yeah.
hopefully the whole community are doing a lot in that space and things will change for everybody with a condition like those. Thanks so much.
Thank you.